Everyone will experience some hand difficulty throughout their life, whether it's because of arthritis, or whether it's because of an athletic injury, whether it's because of repetitive use. Essentially every single human at some point will have hand problems. The hand can be injured in any number of ways, and it ranges from very benign injuries that require simple reassurance to more significant injuries which require sometimes very specialized intervention. Most common injuries are simple fractures. Roughly 700,000 wrist fractures happen annually in the United States. Also, people working in the shop can suffer lacerations and cut things like nerves and tendons. Most fractures require simple protection, such as a removable splint or a hard cast. Some fractures can be given a functional splint that you can actually do most of your activities with, but some fractures do require surgery. Luckily, most of our modern techniques allow patients to pretty much go about their daily activities with minimal interruption. Carpal tunnel syndrome is compression of the median nerve at the wrist. The median nerve is one of the three important nerves that go to the hand. It causes numbness and tingling in the thumb, index, long, and ring fingers. I base treatment on carpal tunnel syndrome depending on the patient's symptoms. If their problem is exclusively nighttime waking, and I give them splints that prevent them from waking with numbness and tingling, that might be the treatment. However, if their numbness and tingling is throughout the day and with activities that they need to do essentially all the time, splinting might not be an effective treatment. In those cases, typically a relatively minor procedure can be done to fix this. Trigger finger is basically a mismatch between the tendon and the tunnel that the tendon goes through in a finger. It often presents as painful clicking, catching, or popping, and sometimes feels like the finger is dislocating. Trigger finger is treated most of the time either by an injection or a simple operation to release the tunnel that the tendon has to go through. Most of the time, arthritis of the hand can be treated with conservative means. Exercises that patient can do on their own, exercises that they can do with a therapist. Sometimes injections are helpful, and sometimes surgery is helpful. Our hand services at Christiana Care are unique in that we have multiple hand surgeons in different practices from different disciplines, all working together to help patients solve their issues with their hands, whether they be simple or complicated.